It's a Northwest Lifestyle Weekend on KOMO News. Here's Tom Hutler and Shannon O'Kelly with more IRG Health Talk.
Our next guest is Dr. Dinh Tran, who specializes in primary care with an interest in sports medicine at Mill Creek Family Practice. And we're going to talk about shoulder injuries today. Shoulder injuries are very common as we head into the football season, Shannon. I bet you'll be seeing some folks who have those.
We absolutely will, but we also see a lot of folks that just have overuse injuries of the shoulder, and that's what we're going to talk about today.
All right, here's Shannon O'Kelly and Dr. Dinh Tran on KOMO.
Dr. Tran, welcome. How are you doing?
Thank you. I'm doing well. How are you?
Well, thank you for joining us on Health Talk. You're a family practice physician in Mill Creek, Washington. That's cool. That's fun. Tell us about your practice.
Yeah, so Mill Creek Family Practice has been around for 35 years. So we're coming on to 35th anniversary. And it's actually the one remaining independent practice in the area for primary care. The one constant is the core value of the practice, focus on the relationship that we build with our patients over the years, and they've been loyal. We see family members. They've been long-term patients there.
I'll tell you how long they've been there. They've been there as long as I've been in Mill Creek. Okay.
Oh, really?
So
Okay.
So we have a lot in common there. About 33, 34 years. It's been there forever. Great providers, great reputation. A large family practice facility there. You have physicians. You have nurse practitioners. You have all kinds of stuff going on there. And your interest as a physician, a family medicine doc, is you see the entire family, but you have a sports medicine, kind of a musculoskeletal interest.
Correct.
And we're going to talk about my favorite joint, and now I know your favorite joint, and that's the shoulder.
Correct, shoulder. That's a common one.
Yeah.
I think 16 to 34% of people have shoulder pain at some point in their lives. So
yeah, it's one of those joints, and when you describe it from an anatomical standpoint, I mean, it's one of those joints that's really unique. I mean, you can do a lot of stuff with your shoulder. It has a ton of mobility, doesn't it?
Absolutely. Shoulder pain, is a common wear and tear injury that can occur. Usually manual laborers and people with repetitive motion, they're more prone to develop that sort of shoulder injury, specifically rotator cuff.
Right. So let's talk about I like to dig into the mechanics because I don't think we get an opportunity to do that a lot on the radio. We're going to do Anatomy 101 here. I'm excited about that.
Sure.
And although we're on the radio, we're going to try to describe it as best we can descriptively.
In layman terms.
Yeah, there you go. So the shoulder has a ton of movement, and with movement, it lacks some stability. It's got a big ball and a small socket, and the rotator cuff mechanism that you just described. So let's set that up a little bit for our listeners.
The rotator cuff consists of 4 different muscle groups, and each muscle group is responsible for a specific function or range of motion. And so over time, injuries, wear and tear, it can affect each different specific muscle group, and that thereby affects the range of motion. And a lot of times, people complain of pain with overhead activity. That's due to the most common injury is called a supraspinatus tendon, which can occur from injuries or wear and tear. That's a very common complaint.
Yeah, so let's talk about the supraspinatus, because the supraspinatus is one of the tendons of the 4 tendons of the rotator cuff. And I want to be really specific here because a lot of patients will come in and sometimes they'll say, I tore or I inflamed or I irritated my rotator cup. Okay? It's not a cup, it's the cuff. And one of those tendons is that supraspinatus tendon, and it's superior. It sits on the top, so you can irritate it, inflame it, and impinge it in a number of different activities. Let's talk about that diagnosis.
Sure. So the main thing is that we look for is in the clinical history in the exam findings, and the supraspinatus is actually responsible for helping you to raise your arm above your head, which is called abduction in medical terms, and also external rotation of your shoulder as well. It's quite common among swimmers, baseball players, football players, anyone with repetitive shoulder motion. And what it is the tendon is kind of like a toothbrush. And so a new toothbrush, the integrity is nice and straight, but over time, with repetitive use and injuries, the fibers and toothbrush is going to spread apart. That's how the tendon is going to look. And so that's what we call tendinopathy. But tendinitis is acute inflammation of the tendon itself. It certainly impedes your ability to do a lot of things with your shoulder, especially raising your arm above your head and combing your hair. Those daily routine can be easily affected by the supraspinatus injury.
We continue our conversation of shoulder injuries with Dr. Dinh Tran from Mill Creek Family Practice right after this timeout on KOMO.
It's a Northwest Lifestyle Weekend on KOMO News. Now back to IRG's Health Talk.
More of our conversation with Dr. Dinh Tran talking about shoulder injuries with Shannon O'Kelly.
Dr. Tran, thank you again for joining us.
Yeah, absolutely.
And thank you for being here, and thank you for allowing me to talk and us to talk about my favorite joint is the shoulder. And we're talking about supraspinatus tendinopathy or tendinitis, but it's really important. You described it really good as far as anatomical where it sits, but maybe tell our listeners, because this new word that you're using maybe is new to them. It's not new to me, but this tendinopathy thing versus tendinitis. What is the difference between a tendinitis and a tendinopathy?
So tendinopathy, another term for it is tendinosis. Basically, what it is it's a common term used to describe the wear and tear process or the degenerative process of the tendon over time. So it's basically, it's kind of like arthritis, wear and tear. So that's what tendinopathy means. Whereas tendinitis is basically acute inflammation of the tendon or irritation. And that can occur from a number of factors, especially injuries or any kind of like shoulder joint instability. Anything can predispose a person to tendinitis. But basically, tendinitis is acute inflammation.
Yeah, the tendinitis is the initial inflammatory response, inflammation, and as that inflammation stays in that tendon,
right,
that tendon becomes a tendinosis, or it becomes a tendinopathy,
right,
which is a histological change in the cells that are trying to heal themselves.
Right.
And believe me, that's so neat that we're starting to talk about that, because that's really where physical therapists, that's where we play.
Right.
Into that overuse and that chronic tendinopathy. And with the shoulder particularly, it's mechanical, and a lot of times you can look at poor mechanics, and that can create mechanical dysfunction, which creates a tendinitis or a impingement. And maybe tell our listeners, when you talk about the word shoulder impingement, what you're talking about there with that supraspinatus tendon.
The mechanics behind it is basically the same as tendinopathy. And basically, it's just impingement, meaning compression on the tendon itself by any of the surrounding structures in the shoulder. And so when a tendon gets impinged or when it gets compressed or irritated, it's going to cause significant amount of pain. And patients complain of pain, especially with certain movements of their shoulder.
Right.
And that can be elicited from the exam findings itself.
Right. I can't tell you how many times over the years, I've seen a patient with shoulder pain, and it's like you ask them on your history and physical, which is the most important aspect of medicine. You ask them, what have you been doing? And they say, for the last 2 weekends, I've been painting my house. And all of a sudden they're working overhead, or they're doing something overhead that they're not used to, and they create that impingement. But as a physician, what is in your toolbox to treat that tendinopathy or tendinitis?
The treatment options are fairly straightforward. It's either non-surgical or surgical. And 90% of the time is mainly just conservative, which is non-surgical options, which includes physical therapy or Motrin, icing, and basically activity modification.
Good stuff. Once again, I want to thank you for your time. Speaking of time, we are out of time. So thank you for all the information on the shoulder, and welcome to Mill Creek Family Practice.
Thank you very much. I appreciate it, and I look forward to sharing more of the information if you guys are interested.
We're interested. Thanks again.
Thank you.
Once again, that's Dr. Dinh Tran talking about shoulder injuries. You can get more information on his practice at millcreekfamilypractice.org. Shoulders, Shannon, I imagine when you first became a therapist were an issue. A lot of people had then kind of unknown things like rotator cuff surgeries. You've been rehabbing shoulders, I bet, for a long time.
Absolutely, Tom. And, the most important thing I want our listeners to remember is if you have shoulder pain, inflammation, get it looked at early. Do not let this stuff linger, because the longer it lingers, the harder it is to get rid of. This is the tendinitis, the impingements, the biceps tendinitis, et cetera, et cetera.
All right. Thanks again. We'll have our final segment right after this time out on KOMO.